Hi everyone, welcome back to my channel. It's Karen from R&Y Karen in Canada. Today is my 8-week update. It has been exactly 8 weeks today that I had my surgery. Can't even believe it. So let's just go over the basics first, because I know everyone always wants to know the numbers. So surgery was, like I said, 8 weeks ago today, February 20th, 2018 at Michael Garron Hospital in Toronto, Ontario, Canada. My highest weight was 231 pounds. My starting weight was 215 pounds. Last week, my weight was 190.8 pounds. And this week, 190.2 pounds. So a whole 0.6 loss from last week to this week. But I am okay with that, because that is a 40.8 pound loss in total, which is amazing to me. Who loses in 8 weeks 40 pounds? Well, me. So I really tried to think of an NSV, a non-scale victory, and I had a hard time this week coming up with one. My clothes are all still fitting much better. I was able to give some clothes away and pass it along to another lady who is going through weight loss surgery too. And she'll be able to fit into my bigger clothes soon, which is great, because as we keep losing weight, it's hard to keep buying clothes after clothes after clothes, because it's expensive. So I'm not going to do it. So I'm just kind of wearing tights and big shirts, unfortunately, right now, and don't really care. I did go through an ultrasound this week, beginning of this week. I think I was last week. Anyways, because I've been having some stomach pains near the incision site on my right-hand side. Everything was fine. Gallbladder's fine. Everything looks fine inside. They're not really quite sure. I asked, is it all in my head? Am I crazy? Am I whatever, you know? Doctor reassured me, no, it's not all in your head. It's in your stomach. So she's going to send me for a CT scan. Now, I don't know how I feel about all this. I'm hoping that it's nothing. I'm hoping that it's just taking me a little bit extra long to get recovered, whatever. But what I do have, and what does worry me a little bit more than the stomach pain, I guess, is how dizzy I am. From sitting to standing, or lying down to sitting up, I'm dizzy. And it's hard for me to move my head back and forth. I'm really struggling with driving. I don't remember the last time I actually drove anywhere. Because it's not safe for me to be out on the road dizzy like this. So, and what's frustrating me most is I'm really independent, and it's hard for me to ask even family members right now, to take me to the grocery store, or to pick up something for me, or to, for me to not drive somewhere if I want to go somewhere. So, that's kind of bumming me out, but I'm going to get through it. Another thing that I mentioned last week was that I had said that my iron levels are really low, and that's very common for people with bariatric surgery, especially women. But what I didn't realize, I reread I reread the blood work papers that they give you, or my doctor does anyways, and my iron is really high. And it was ridiculously high. And after going to the bariatric clinic this week and talking to them, they all realized that I'm not a female who menstruates anymore. I had a surgery, and that's a long story. I don't have that issue of menstruating anymore, and so I don't need to take iron. I really wish I would have known that before I kept taking 3 iron pills a day. And this is where I want to vent a little bit. Just let me vent for this. Left the hospital, wasn't told not to get off my blood pressure medications, which I totally understand, because Most people don't get off of them right away. Taking iron pills, and should have been told that I don't need to do that. I really think they should have caught that, because I did mention that right from the get-go, that I had this, cervical ablation and I don't menstruate anymore. And I really think they should have mentioned that, hey, you don't need iron. Maybe that's why I feel like shit a lot of the times too. I don't know. But I really think that we as bariatric patients need to be more vocal, and we need to advocate more for ourselves. And I'm really good at doing that at my job. I'm really good at advocating for others. And I did think I was doing that for myself. But I guess I wasn't as educated as I thought I was. And it's so overwhelming sometimes that I really do think you need to make an appointment with your family doctor for 2 weeks after your surgery. You have to get in there. I know that at our clinic here, we don't have any kind of post-op follow-up from discharge until 1 month. And for me, it would have been really important for me to make a doctor's appointment 2 weeks post-op. I think that would have really helped, knowing that I should have been off those blood pressure pills, and maybe not the iron, because I don't think the family doctor may really truly understand the significance of the vitamin and the iron. But maybe I should have spoken to my pharmacist and just clarified that this is what I'm going through, and this is what I'm having. I just find a lot of people in that are not in the bariatric world don't know a lot of the answers, and I understand that, and I'm not upset about that. I just think either we need to educate them, or they need to educate others more, or themselves more. So that's my little vent. Okay, I'm sorry, I'm done. Something else. What else? Oh, okay. TMI time. Since getting off the iron, they said to me, oh, maybe your bowel movements will be more regular or whatever. Well, that hasn't happened yet. I just had my appointment on Thursday. Last Thursday, today is Tuesday, so still nothing all quite regular. I have been taking Clear Lax, which is like Restoralax, and I was having a small bowel movement. Sorry, it's kind of gross. Every other day. And when we had went to the 1 month post-op nutrition meeting or nutrition whatever, the lady said it's okay if you go every other day. So I was under the impression that was fine. The doctor at the bariatric clinic said probably it's better to go every day. So that got me worried too. And she said after you get off the iron, that should help. Well, it's not helping. So I thought about taking a Senecot or something like that. I've read a lot of Facebook pages that a lot of the men and women through bariatric surgery are taking Senecots and laxatives and things like that. But I don't really want my body to get used to that. So what I did last night was I purchased the tea, or I purchased this a while ago, but I finally took it, the Smooth Move tea, the French side, I don't know. I did get it off of Amazon, but I know that you can get it anywhere. It says for the occasional relief of the overnight relief of occasional constipation. It helped today. Let's just let you know that. But it really did give me a sore stomach, which I don't really need a sore stomach because I already have one. But so I don't know. I'm not regretting ever that I had this surgery. I glad I did all my research prior to having it. I do think there should be more follow-up after your surgery. And if I do this ever again, you know what I mean? If people, they said if I did it again, I would do it differently. I would make sure I booked those appointments. Ask more questions, I guess. Do I need this? Do I need that? And just advocate more for myself. And, last week when I was at the doctor's office, I insisted on making sure I had a follow-up appointment this week, and continuing to find out what's wrong with me. They haven't called for the CT scan yet. So maybe I need to advocate about that. Little things, just trying to keep on top of everything and trying to stay positive. I really am trying to stay positive through all this. I lost 40.8 pounds. This is great. I'm still feeling good. Besides, whatever the aches, I feel better. My clothes are fitting better. So those are the things that I need to remind myself of when I'm a little in pain or a little upset or need to vent, because it's really not like me. Okay, I think that's all for today. I will let you know next week how I made out at the doctor's, what's going on, and hopefully have a little bit more movements down there so that the numbers go a little bit more than 0.6 pounds. But hey, if it's 0.6 again next week, it's 0.6 again. All right. Thanks all for watching. Don't forget to subscribe down below and hit like, and hey, share away. Take care. Bye-bye.